Let's talk about one of those weird Medicare rules that you never really think about until you're affected by it. And it's going to surprise literally anyone that encounters it. So, what I'm talking about is something that involves hospital observation status rather than inpatient admission. Now, most people assume if they stay overnight in a hospital room, especially if they have a bed, that means they've been admitted into that hospital as an inpatient. But under Medicare rules, that's not always the case. Sometimes patients are placed under observation status, even if they're inside a hospital in a bed, because it's technically going to be considered outpatient care. That means that even if someone spends the night in a hospital bed and receives tests and is treated by the hospital staff, Medicare may still end up classifying that stay as outpatient rather than inpatient. Now, why does that matter? This matters whether you're on a Medicare Advantage plan or traditional Medicare. Medicare's coverage works differently depending on how the hospital classifies your stay. If you're inpatient in the hospital, obviously your stay will be classified under Medicare Part A. Observation statuses, however, or observation stays, excuse me, however, are generally billed under Medicare Part B. That difference affects not just the billing, but also the coverage rules of what you can have done. One of the most well-known consequences that involves this would be with skilled nursing facility. Traditional Medicare, Medicare has what's called a three-day inpatient hospital stay requirement before they will pay if you're transferred to a skilled nursing care facility. And observation days don't count towards that requirement. So if someone comes into the hospital, they're not admitted, but they still spend several days in the hospital under observation status. If they're not formally admitted as inpatient, they may not qualify for the Medicare coverage of subsequent skilled nursing care stay. And its situation is the subject of lots of policy debate around why Medicare does what it does and several legislative proposals depending on your state. Hospitals use what's known as observation status for several reasons. Sometimes a physician is monitoring a patient and they're wanting to determine whether their full admission is even necessary, right? In other cases, hospitals may be following Medicare's billing guidance, and that encourages very careful documentation before you can even classify someone as an inpatient stay if you want Medicare to reimburse you. Obviously, the goal is to ensure that admissions meet Medicare's criteria for inpatient care because hospitals need to be paid for treating people. But for the patient, the distinction is absolutely confusing and could be detrimental